Hello, I'm Dr. Steve Ballou, and I teach family medicine at the University of Ottawa in Canada. Today I'd like to talk to you about how to take a history of a patient with chest pain. There are a lot of reasons that people might have chest pain, and most of them have nothing to do with the heart. So how can you tell the difference? I would like to give you a map that will guide you in your questionnaire, and the map is your own body. I want you to think of what's in your own chest, and that will guide your questions. If you start on the outside, you have muscles and skin and bones. Inside that, you have a heart and 2 lungs, and then all of that is wrapped around your esophagus. And finally, they're all connected to your brain. So if we start with the chest wall, the outside, there are many reasons why somebody might have pain of their chest wall. And you can find this out by asking, are they tender when you touch a certain part of the chest? Is the pain worse when they're in a certain position or when they're lifting something? And was there a recent injury? Or have they been lifting weights? Or were they in a car accident? Or have they been painting the house? All of these things can cause pain of the chest wall. Inside the chest wall is the heart. And heart pain can be very typical. It's usually pain on exertion. It's usually where the heart is. And often people will make a sign with their hand showing the type of pain. They may have shortness of breath, they may have nausea, and they may have palpitations. On either side of the heart are the lungs. And they can also cause pain. So you might ask about shortness of breath, cough, sputum, or fever. And then all these are wrapped around the esophagus, which can also give chest pain. Typically, it's a heartburn, maybe nausea, maybe difficulty swallowing, and it may be associated with taking medication. And finally, as I said, everything is connected to your brain. And by that, I mean emotions. And emotions can give you chest pain, and it's probably the most common cause of chest pain. You can have pinching pain, burning pain, crushing pain, all related to emotional problems, money problems, work problems. So how do we find the important one, which is, of course, heart pain or angina? A good question is, what makes it worse? Typically, angina is pain on exertion or on effort. And then you can ask, what makes it better? And again, typically angina gets better when you rest. It's very important to ask questions about previous medical history. Has the patient ever had real angina? Does the patient have a history of hypertension or hyperlipidemia? And more importantly, is there a family history of heart disease? A very important question to ask is, does the patient smoke? Because that one factor makes angina much more likely. So to summarize, angina or heart pain is typically pain or heaviness in the chest, worse with exertion, better with rest, sometimes with nausea, sometimes with palpitations. And the patient may make the fist sign to help you. So the patient who presents with chest pain can have many possible diagnoses. If, after your questionnaire, you think it may be the heart, then you must make an evaluation in a hospital. You have no choice. And we have some very good tests to help you decide. And finally, if you're not sure, you can always ask a colleague. Thank you very much.